this hope will not lead and in this hope will not lead to disappointment, for we know how dearly God loves us, because He has given us the Holy Spirit to fill our hearts with His love. Romans 5:5. Okay. So remember how the last video it was cut short, but basically it said which drug combination is responsible for muscle pain, fatigue, increased creatinine levels, and diffuse tenderness in proximal muscles. So the answer was atorvastatin and gemfibrozil. Um, this is because statins. Okay, so statins are first line for hypercholesterolemia. Statins to decrease total cholesterol, LDL, and triglyceride levels. Statins inhibit HMG-CoA reductase. Giving statin with fibrates, especially gemfibrozil, increase the risk of severe myopathy. Um, also, um, nitrates impair hepatic clearance of statins. So statins increase in the blood. So basically, if we give a nitrate along with a statin, there will be increased statins in the blood. A side effect of statins is myopathy and hepatitis. So that's why you get myopathy when you give atorvastatin and gemfibrozil together. Yeah, so giving statin with fibrates increase risk of severe myopathy. Alright, what is the underlying mechanism of drug toxicity in this patient, which is an acetamin overdose? It is drug metabolite induced mitochondrial dysfunction. So this patient has a acetamin overdose, and the symptoms are right upper quadrant pain, nausea, AST, ALT over 1,000, centrilobular necrosis. Increased acetamin use causes toxicity through N-acyl P-benzoquine imine. So increased acetaminophen use causes toxicity through N-acetyl P-benzoquinone, and this disrupts hepatocyte mitochondrial function. And this induces oxidative injury in the liver, and this causes increased AST. Okay, and excessive amounts of NAPQ1. NAPQ1. Yeah, so that's the same thing. NAPQ1 is N-acetyl P-benzoquinone imine. Okay, so let me just write that down. So yeah, NAPQ1, and then excess amount of NAPQ1 form adducts with hepatic proteins, and this disrupts the hepatocyte mitochondrial function, which leads to oxidative injury. Okay. So yeah, so because when you eat too much Tylenol, you have increased um, NAPQ1, and this causes mitochondria in the liver to be damaged, and this causes oxidative injury in the liver. Yeah, this causes oxidative injury in the liver, and this increases AST levels. So the answer is drug metabolized induced mitochondrial dysfunction. Drug metabolized induced mitochondrial dysfunction. 163. An antiretroviral drug plus an adjuvant drug improves the vital control through which mechanism? An antiretroviral drug plus an adjuvant drug improves viral control through which mechanism? An antiretroviral drug plus an adjuvant drug improves viral control through which mechanism? Answer is inhibitory cellular efflux transporters. Okay, so there is a P glycoprotein. This is the efflux pump found in the brain capillary endothelial. Okay, so is P glycoprotein efflux pump is found on the brain capillary endothelial cells, and which is part of the blood-brain barrier, and this inhibits substrates from entering the brain. Efflux pumps transport lipophilic molecules which have diffused through the cell membrane back into the blood. So efflux pump shunts the drugs and molecules away from the brain. So you can block this efflux pump to allow drugs to get into the brain and work. Inhibiting the P-glycoprotein can improve the drug delivery to the CNS. So an antiretroviral drug plus an adjuvant drug improves viral control through which mechanism? So it stops the brain pump. So it stops the inhibitory cellular efflux transporters. So P-glycoprotein is an efflux pump found on the blood-brain barrier, and that stops substances from entering the brain. This P-glycoprotein pump transports fat-liking molecules which are diffused through cell membrane into the blood. So efflux pumps shunts these lipophilic molecules away from the brain, so you can block this efflux pump to allow drugs to get into the brain and work. So you can block this pump. Yeah, you can block this pump to allow drugs to get into the brain and work. Inhibiting P-glycoprotein can improve drug delivery to the CNS. Okay, 164. A 68-year-old female presents with burning sensation in the chest and throat. For the past 2 weeks, she has trouble swallowing. The medication is responsible The medication responsible for the presentation is also associated with what side effect? Osteonecrosis of the jaw. So, this person is on bisphosphonates. So bisphosphonates cause medication-induced esophagitis, which is burning and chest and throat. Yeah, which is burning, chest and throat pain, and dysphagia. It is caused because bisphosphonates disturb the protective phospholipid layer in the lower esophagus, and refluxing gastric acid causes mucosal erosion and ulceration. Okay. It's contraindicated in people with achalasia, because achalasia is a narrowing of the LES, lower esophageal sphincter. So it's contraindicated in people with any kind of esophageal stricture or achalasia. Okay. Osteonecrosis is given in osteoporosis, and it works by decreasing osteoclast function. Let's see, bisphosphonates. Bisphosphonate. So here bisphosphonates, you see this? Osteoclast, okay. So mechanism of action is pyrophosphate analogs. They bind hydroxyapatite in the bone, inhibiting osteoclast activity. So I'm just going to make a note of that. Osteoclast. Osteoclast. Oops. Okay. Osteonecrosis also causes stress fractures of the femoral shaft and subtrochanteric zone. Okay, so osteonecrosis also causes stress fractures of femoral shaft and subtrochanteric zone. It lowers the blood calcium levels, so it's used in hypercalcemia. This is talking about bisphosphonates. It lowers the blood calcium level, so it's used in hypercalcemia. And bisphosphonates also cause stress fractures of the femoral shaft and subtrochanteric zone. Okay, 165 is a cancer study was done. A cancer study was done, and study showed lower serum concentration of endoxifen and 4-hydroxytamoxifen in relapsed breast cancer patients than those in cancer-free patients. So, okay, a cancer study was done, and this showed lower serum concentration of endoxifen and 4-hydroxytamoxifen in relapsed breast cancer patients. than those in cancer-free patients. Okay, so they had lower endoxifen, like um, breast cancer patients, relapsed breast cancer patients, had lower endoxifen and 4-hydroxy tamoxifen in their blood than those without cancer. Endoxifen and 4-hydroxy tamoxifen are both metabolites of tamoxifen. What caused the lower serum concentrations? Um, the answer is polymorphism of a cytochrome P450 enzyme. So, tamoxifen is a selective estrogen receptor modulator used in the treatment of estrogen receptor positive breast cancer. Tamoxifen is metabolized by CYP2D to its active metabolite, endoxifen. If there is a genetic polymorphism in the CY2PD, then that leads to decreased CYP2D activity, which leads to decreased level of active metabolite of endoxifen and increased risk of cancer relapse. Okay. So this drug, tamoxifen, is broken down by CYP2D to its active form, endoxifen. If there is a polymorphism in the CYP2D, then it will not break it down. It will not break it to endoxifen. Um, and then that causes increased cancer relapse because it's the endoxifen is not working. Okay. (166) A 34-year-old kidney transplant patient is treated with cyclosporin and now has nausea, anorexia, and the creatinine is 3.4, and serum cyclosporin is up. BP is 160/186, but BP and cyclosporin levels were normal 1 month ago. He has been taking grapefruit juice. What caused his current condition? So basically, there's a kid, there's a 34-year-old kidney transplant patient on cyclosporin, and now his creatinine level is way high, and the cyclosporin is up. Yeah, cyclosporin level is up, and he's also been on grapefruit juice. What caused this current condition? Grapefruit juice is a cytochrome inhibitor. Okay. So inhibition, what causes inhibition of cytochrome P450 in the gut wall? Grapefruit juice stops the cytochrome P450 from working, and then the things that are drugs that are broken down by cytochrome P450, like cyclosporin, will build up. Okay, so basically, grapefruit juice is a cytochrome P450 inhibitor, so cyclosporin should build up, leading to renal vasoconstriction and tubular cell damage and acute renal failure, which is seen by the increased creatinine. Okay, and cyclosporin is metabolized by the liver. Okay, cytochrome is metabolized by the liver and GI tract by the cytochrome P450. Okay, so cyclosporin is metabolized by the liver and GI tract by the cytochrome P450, and so when this drug builds up, you get calcineurin inhibitor nephrotoxicity. Yeah, okay. So I'm going to show you the inhibitors. Okay, grapefruit juice. cycle. So cyclosporin is a calcineurin inhibitor. It binds cyclophilin and blocks T cell activation by preventing IL-2 transcription. You give it for rheumatoid arthritis and psoriasis, and the side effect is nephrotoxicity. And that's a big one. Okay, nephrotoxicity, hypertension, hyperlipidemia, neurotoxicity, gingival hyperplasia, and hirsutism. So both calcineurin inhibitors are highly nephrotoxic, especially in higher doses in patients with a decreased renal function. So remember, this is a kidney transplant patient. So they are going to have kidney issues. They're going to have, they can't, so yeah, they don't have enough kidney to counteract the cyclosporin. Okay, so you have to be very careful when you give it. It's highly nephrotoxic. Okay, especially if they're on grapefruit juice. Let me show you the inhibitors. Okay, grapefruit juice. Okay, so these are the P450 interactions. You see the inducers here. Let's start with the inducers because I memorize it that way. So inducers are modafinil, chronic alcohol use, St. John's wort, phenytoin, phenobarbital, nevirapine, rifampin, griseofulin, and carbamazepine. Okay, inhibitors are sodium valproate, isoniazid, cimetidine, ketoconazole, fluconazole, acute alcohol abuse, chloramphenicol, erythromycin, clarithromycin, sulfonamides, ciprofloxacin, omeprazole, metronidazole, amiodarone, ritonavir, grapefruit juice. So erythromycin, clarithromycin, sulfonamides, ciprofloxacin, omeprazole, metronidazole, amiodarone, ritonavir, grapefruit juice. Okay, so what this means is inducers break down cytochrome 50 faster. Like they make the cytochrome P450 work faster, and inhibitors slow the cytochrome P450 down. Yeah, they slow the cytochrome P450 down. So when you give another drug, for example, in this case of cyclosporin, grapefruit juice went and slowed the cytochrome P450 down, and when it did that, cytochrome P450, yeah, when it did that, the cyclosporin built up? Because cyclosporin is also broken down by cytochrome P450. So it built up. The cyclosporin built up because grapefruit juice went and pretty much slowed the cytochrome P450 down. So then cyclosporin built up. So remember this. Inhibitor has sodium valproate, then it's isoniazide, then it's metadine, then it's ketoconazole, then fluconazole, then acute alcohol abuse, then chloramphenicol, erythromycin, clarithromycin, sulfonamides, ciprofloxacin, omeprazole, metronidazole, amiodarone, ritonavir, grapefruit juice. So inducers are modafinil, chronic alcohol use, St. John's wort, phenytoin, phenobarbital, nevirapine, rifampin, griseofulvin, carbamazepine. Alright, next. Women, Gravida 1, Para 0, delivers baby at 39 weeks. Strong baby. Head circumference measures less than 10%, and placenta has many calcifications. Baby has congenital toxoplasmosis. What is the reason for using combination of pyrethamine and sulfadiazine? What is the reason for using combination of pyrethamine and sulfadiazine? Okay. Why are you okay? So the baby has a congenital toxoplasmosis. Okay, and why are you giving pyrethamine and sulfadiazine? This is due to synergistic reduction of DNA synthesis. Yeah, this is due to synergistic reduction of DNA synthesis. Okay. Synergistic reduction of DNA synthesis. So the sulfadiazine inhibits the dihydrotoprate synthase, and pyrethamine inhibits dihydrofolate reductase. So you get to know congenital toxoplasmosis is treated with sulfadiazine and pyrethamine, which work together to inhibit the formation of tetrahydrofolate, and this causes a decreased purine nucleotide synthesis. Okay, so basically, the sulfadiazine and pyrethamine decrease the purine nucleotide synthesis when given together. Yeah, decrease purine nucleotide synthesis when given together. So congenital infection with Toxoplasma gondii causes intracranial calcification, hydrocephalus, chorioretinitis, jaundice, and thrombocytopenia. Okay, so sulfadiazine inhibits dihydrotoprate synthase. Pyrimethamine inhibits dihydrofolate reductase, and okay, so this hydrofolate reductase is the thing found in humans, which is why pyrethamine is given to prevent tetrahydrofolate generation in the human cells, because pyrethamine inhibits dihydrofolate reductase. Levodorin is a derivative of a tetrahydrofolate, and is also given with pyrethamine to give a bypass effect for generation of host purine nucleic acids. Okay. So, yeah, sulfadiazine inhibits dihydrotoperate synthase. Pyrimethamine inhibits dihydrofolate reductase. Okay. And together, this causes synergistic reduction of DNA synthesis. Okay, 168. Why would metformin build up in heart failure patients? It's because decreased renal blood flow. Heart failure causes decreased liver and kidney blood flow, low volume of distribution of drugs, and this leads to decreased drug clearance. Decreased drug clearance is dangerous for drugs with narrow INR. Metformin is renally excreted, so patients with renal insufficiency or chronic kidney disease patients or heart failure patients should be cautious when taking metformin. Metformin can cause lactic acidosis in CKD patients. Metformin inhibits gluconeogenesis. Metformin increases glycolysis, so metformin increases peripheral glucose uptake into cells. Metformin increases glycolysis, so metformin increases peripheral glucose uptake into the cells. Heart failure. So this decreases liver and kidney blood flow. There's a low volume distribution of drugs. There's low drug clearance. So low drug clearance is dangerous for drugs with narrow INR. With narrow INR, okay. Metformin is renally excreted, so patients with renal insufficiency. Metformin is renally excreted, so patients with renal insufficiency or CKD or heart failure should be cautious when taking metformin. Metformin inhibits gluconeogenesis. Metformin increases glycolysis, so metformin increases peripheral glucose uptake into the cells. Metformin can cause lactic acidosis in CKD patients. Okay, so why would metformin build up in heart failure patients? Is a decreased renal blood flow, heart failure. So heart failure decreases liver and kidney blood flow. Low volume distribution of drugs. Low volume distribution of drugs causes decreased drug clearance. Decreased drug clearance is dangerous for drugs with narrow INR. Metformin is renally excreted, so patients with renal insufficiency or CKD or heart failure should be cautious when taking metformin. With renal insufficiency, okay. Renal insufficiency or CKD or heart failure should be cautious when taking metformin. Following 169, following IV propofol will get delivered to which target tissue? Skeletal muscle. Okay, so propofol is high in blood after an IV injection. Then it goes to well-perfused peripheral compartment like the brain, liver, kidneys, lungs. Then propofol will go to the poorly perfused peripheral compartment like skeletal muscle, fat, bone, all of which have the highest volume of distribution for lipophilic agents. Okay, so propofol is high in the blood after IV. Then it goes to the well-perfused peripheral compartment like brain, liver, kidneys, lungs. Then propofol will go to the poorly perfused peripheral compartment like skeletal, muscle, fat, bone, all of which have the highest VD for lipophilic agents. Okay, so remember that after IV, the target tissue for propofol will be skeletal muscle. $170. 2-minute break. Okay, like 15-minute break. Sorry. We can end the video here and then we'll continue next video.